I'm Dr. Scott Fuller. On this show, I want to talk about coronavirus numbers and some issues that we have with the accuracy of numbers. I'm going to talk about a solution to make sure that the numbers that we are counting on are accurate. As we are, the problem I have is if the numbers are not accurate, we are creating public policy according to these numbers, so we need them to be accurate. So we're going to talk about, unfortunately, the morbid aspect of coronavirus deaths. And I'm going to specifically target the United States. And before I get into why the numbers are inaccurate, and some of you might have come across these articles, I want to talk about more hope and less fear. The hope is of course, 99% or 99.9% of people that get exposed to the coronavirus will live. And we know that if we work harder at our immune system, and basically the health of the host, right? The healthier we are when we become exposed to any virus, whether it be a seasonal flu virus, many of them are coronaviruses and so forth, we have a better aspect of coming out on the other side okay. So toward the end, I'm going to talk about strengthening our immune system. And recently, a company hired me to do 5 different webinars for their company to improve the health of their employees. They did a brain health month. And in those videos, I did 5 subjects they asked me to do, and it was just wonderful. I did one on meditation and mindfulness. I did a second webinar on reducing stress. I did a third one on nutrition and supplements for the brain. I did a 4th one on exercise and a 5th one on sleep. And that was just such a fantastic program, and that's addressing most of the things that also help improve our immune system. Remember, as I get into the numbers, every life is precious, and I keep that in mind as I talk about these things, we talk about these things, and everyone is a precious life. I know people who themselves have lost their lives to coronavirus and families that have lost members to coronavirus, so this is not taken lightly. Here we are on August 9th of 2020. Johns Hopkins, which many people follow for their numbers, there are 162,000 deaths in the United States and 5 million confirmed infections. Why can't we trust the numbers? So, hospital administrators are unfortunately incentivized to potentially reclassify someone who might be a non-COVID death to a COVID death. Now, I was hearing stories like this about 6 weeks ago, and it puzzled me. I'm like, how would they get any more money? I mean, it's just, unfortunately, somebody that passed away, and how does that change? I just couldn't add it up until recently somebody told me what was going on and reminded me of our HHS, Health and Human Services Administration, which was bailing out hospitals and clinics and doctors and so forth by giving them assistance during the pandemic, and how a lot of procedures in hospitals were being canceled and postponed and so forth. So a lot of income to hospitals was drastically reduced. If this had continued without bailout, a lot of hospitals would be in danger of going under. So what I found out was if a hospital has a bed that's occupied by a COVID patient and that patient passes away, if it's classified as a COVID-19 death, the HHS stimulus is higher because the hospital can demonstrate that they had a loss of income because that bed was occupied by a person with COVID as opposed to a bed with something else. So this can be in the tune of millions or tens of millions, and we know from the HHS bailout, it's billions of dollars, a couple of $100 million going to hospitals and clinics and so forth. So I then caught word from another doctor that there are 2 hospital administrators that admitted that this practice is going on. Now, as I say this is very, very important. I am not casting any blame anywhere. This might have been just the law of unintended consequences. Hospitals were in trouble. Clinics are in trouble. We need doctors, we need nurses, we need administrators, we need facilities for all kinds of reasons, including coronavirus. So there's nothing here. Then HHS says, oh my gosh, we've got to rally quickly and we have to get this legislation passed so we can bail these people out. Okay. But now there's incentive to reclassify people. And there's a couple of hospital administrators that admitted we are taking someone that didn't necessarily die with a confirmed COVID-19 death, and it's being reclassified, so they get a better reimbursement. I thought, oh, Now I understand, right? Well, the problem is if we have 162,000 deaths in here, and according to the American Hospital Association, there's over 6,100 hospitals in the United States. So doing some quick math now, not all those hospitals are dealing with people with end-of-life care and having patients that might lose their lives. A lot of these clinics can be orthopedic clinics and so on and so forth. But then I just thought, well, let's say it's 2,500 hospitals around the country. I just picked a number, and if you are into these things and you know hospitals better than I do, then you can certainly comment in the video and straighten some of these numbers out. But let's say it's 25 hospitals around the country that are dealing with potentially fatal diseases and disorders, whether it be heart diseases and heart attacks and strokes, cancer, Alzheimer's, Parkinson's, whatever it might be, and coronavirus infections. Let's say it's 2,500 hospitals. Let's say 10 people in each of those hospitals is reclassified from a stroke or a heart attack or a cancer to a coronavirus or COVID-19 death. All of a sudden, that's 25,000 people that were misclassified. What if it's 20 people per hospital of these 2,500 hospitals, and I'm making these numbers up? That's now 50,000. Let's say it's a bigger hospital. Let's say it's not 2,500 hospitals. Let's say it's 1,000, but it's 50 people reclassified. I don't know. And it doesn't matter, and I'm going to get into how to correct that in just a moment. But now you're dealing with tens of thousands of people that literally are not, shouldn't be in those numbers. And a couple of things happen. Number one is we are dictating public policy of what can be open and what can't be. Can schools open or not? How much can be open and how much not, according to these numbers. There's also the fear factor of all of us, not just in the United States, but across the world. So then one has to wonder, how deadly is this coronavirus if these numbers are artificially inflated because of that? We also heard those news reports of labs in Florida that all of a sudden had 100% positive test results from coronavirus, COVID-19. Some of that was maybe debunked, but what if that is actually going on? I don't know what the incentive would be for a laboratory to be stating that, but that would also hyperinflate these numbers and make it more of a problem, and we're inappropriately dictating healthcare policy according to these numbers. Now, that's shame on all of us. It's shame on all of us because we need these numbers to be scientific and accurate moving forward. On the local NPR station here in Boston, WBUR, there was a local report, and if anybody can track this down, I tried, and it was difficult for me to find. But anyways, it was June 2nd of 2020. It was at 7 a.m. And I believe it was Bob Oakes who does the NPR, the WBUR morning edition reporting locally. And of course, this has nothing to do with Bob Oakes. I'm just letting you know in case somebody can track this down. He stated, Massachusetts is now counting those who express symptoms that are similar to COVID-19, but have not been confirmed and not necessarily tested, just suspected. And I thought, well, if we're including now suspected numbers in there, and if it's not accurate, that's a problem as well. More on that as I talk about the seasonal flu as we go along. There was just recently on NPR on August 4th by Ina Jaffe, there was a title of this article, Nursing Home Residents Moved Out to Make Way for COVID-19 Patients. So some nursing homes were converted into COVID-19 facilities, but unfortunately there's a financial incentive to this as well, and you can look this article up. Here was the problem with that is a lot of people that are long-term in a nursing home, the bills are paid by Medicaid. The Medicaid reimbursement is much lower. Now, if you have a COVID-19 facility with short-term care going on with particularly COVID-19, its reimbursement is by Medicare. And according to this article, the Medicare reimbursement could be 4 times greater than the Medicaid reimbursement. And in this article, they talked about one woman that was shifted from one facility that she loved and was getting great care to another facility, even in the same network, where the quality of care was a bit less, and they couldn't move back to the other one because it ended up being a full-time COVID-19 facility. So that's another problem just kind of wrapped in there. And we have to just be careful about reimbursements, right? Reimbursements might change behavior in facilities and so forth. That's part of the issue here. So you can look that one up. Okay. Then a little bit of perspective. I want to give some perspective here. I'm going to talk about seasonal flu numbers, and then we're going to talk about coronavirus numbers. Now, at the end, I want to give some solutions to this. Okay. And the 2017-2018 seasonal flu numbers, again, these are all CDC, very easy to find, very easy to find. In 2017 to 2018, there were 45 million people that got sick. Now, comparing that to coronavirus, which is 5 million, and these are just United States numbers now. There were 21 million medical visits with a great strain on the medical care system. There was 810,000 hospitalizations in 2017 to 2018 for the seasonal flu, with 61,000 deaths. I say these numbers to people, and people are like, I never knew that. It mostly never made the news. The year later, 2018 to 2019, seasonal flu, now 35 million illnesses, 16 million medical visits, 490,000, almost 500,000 hospitalizations, great strain on the medical care system, 34,000 deaths. Now, here we are in the 2019-2020 season, wrapped in with coronavirus, and I was reminded of this by a nurse practitioner. She said, don't forget, we're having a bad flu season this season too. There are 39 to 56 million illnesses from the seasonal flu, 18 to 26 million medical visits, 410 to 740,000 hospitalizations, again, a great strain on the hospital care system, with 24 to 62,000 deaths from the seasonal flu this flu season. One of the issues with this as well is the CDC says we have stopped counting the seasonal flu deaths starting on April 4th of 2020. Now, I might be wrong in this. Somebody can straighten me out on this. But I don't think you should be stopping counting the seasonal flu, because the seasonal flu can affect people and get them sick and maybe even kill them year-round in the United States and any other country. The numbers, of course, are smaller in the summer. But I don't think we should be stopping counting that. And I wonder, is it possible that people that get sick with seasonal flu and might even potentially, God forbid, lose their life, are they now actually being counted as a COVID-19 illness or death? So I wonder about that. I'm not a virologist. I'm not an epidemiologist. I'm not an infectious disease expert. And nothing I say here has anything to do with any medical advice. But I just kind of wonder, and that's just pulling in some of the complications here. So here's what I propose as a correction to these numbers to make sure that we are reporting. We all understand, all of us, all humans on the planet working together, doctors and healthcare facilities and hospital administrators, infectious disease people and epidemiologists, researchers, scientists working on vaccines, whatever it might be, we all need to be wrapping our head around accurate numbers. Number one I propose is, let's have an anonymous reporting system to the CDC, or somebody else for that matter. So we can have an intermediary panel that we could set up like in a day that can receive anonymous reports from all hospitals that are reporting coronavirus numbers. We would guarantee no repercussions whatsoever to anyone. We just want anonymous, accurate figures. Hospital administrators could go back in their data and say, yeah, there were some that were classified inappropriately as COVID-19 deaths and COVID-19 infections. Here are the accurate numbers. They're going to report the accurate numbers. No money needs to be returned. And so we're going to have the reporting numbers, and this panel can now take the anonymous numbers and report it back to the CDC, Johns Hopkins, and everybody else who is counting, and then we can have some accurate numbers. Number two, we're going to have to change the HHS reimbursement. And that can be done, I think, simply. Somebody can correct me if this would be wrong. But let's say I'm a big hospital and my budget is $100 million a year. And that was in 2019. In 2020, I'm down 25%. I'm down 25 million. The HHS bailout to me can be 25 million. It doesn't matter how few or how many COVID-19 infections I'm handling and deaths and how many beds are down. My income has dropped from this to this. And then that would be the bailout money moving forward. And again, it won't have anything to do with the numbers of infections and so forth. Okay. lastly, for the rest of us, the solid foundation is always the same. It's the health of the host. If we improve our health as individuals, as children, as families, as communities, and so forth, we're going to best resist infections. Now, Zach Bush reminds us that the number of viruses on the planet is astounding. Some have said if you take a typical building, there's more viruses in there than there are stars in the sky. We're not going to eliminate all viruses. We're not going to kill them all. As a matter of fact, if we had some way to do that, we would all perish. We can't kill them all, but we can relate to them better. The ecology, the balance between health of the host, us, and viruses and so forth, that can be improved. I'm not saying not do all the infection control, which with all the really smart people, much smarter than I, are doing. But it's the health of the host. Zach Bush was saying, if I have this right, there's 10 to the 33rd, that's a big number, 10 to the 33rd viruses in our air, 10 to the 33rd viruses in our water, 10 to the 33rd viruses in our soil. There's a lot going on. So it's not necessarily about killing them all, it's about improving our own health. And I think improving our own health comes down to 6 things. Number 1 is, of course, clean eating, the cleanest nutrition that you and your family can tolerate. Number 2 is regular exercise. To your best benefit, remember, this is not medical advice. Check with your doctor first. Get clearance on the amount and type of exercise that you can do. Number 3 is reducing stress. Now, when I say reducing stress, there's all kinds of methods that you can do that. There's the mindfulness and meditation and yoga and qigong and tai chi, and of course the huge explosion of online classes and guidance and so forth. Of course, there are now very safe, socially distanced classes going on. Here we are in the Northeast. Right now the weather is good, so they're having a lot of outdoor classes that can be socially distanced with masks and so forth. That's very, very good. A lot of places are opening up in large facilities if there are large floor areas where people can be easily separated. A lot of people said, I can't go back to yoga class. Well, now you can, because some facilities are opening up that can do that. Taking care of the spine and nervous system. I'm a chiropractor. That's what I do in my office with the thousands of people that I've been able to help through the years. Babies, children, adults, and elderly. When people come in to see me, we're working their spine and their brain and their nervous system, giving them the best chance possible of having a healthy body and a healthy immune system. And then sleep. And by the way, if you want to do a deep dive into sleep, I just finished the book, Why We Sleep by Matthew Walker. Unbelievable book. Boy, it can really shed some light on that. Don't forget that meditation has been shown by Dr. Joe Dispenza and other researchers that you can improve your IgA, immunoglobulin A, immediately with meditation. That helps your immune system. Dive into that. And don't forget that great study in 1991 out of the New England Journal of Medicine where they dripped live influenza viruses in people's noses because they were testing how stress can affect your immune system. Do you want to sign up for that research? Dripping a live virus in your nose. By the way, one of them was a coronavirus, but not everybody got sick. 25 to 40% got a cold, something like that. And it correlated exactly with the more stress that was reported, the more rates of infection. Interesting, 1991. Here's some resources as we wrap up. I mentioned Zach Bush. You can put in, he's done a variety of recordings in 2020. The one I liked was, if you can go to YouTube and search Wellness Force with Zach Bush. You can also look at London Real TV with Zach Bush. Judson Brewer, he has some great programs on coronavirus anxiety. Judson Brewer. Peter Attia and Sam Harris did a great show, which I talked about in the past. One of the suggestions they had there, if we did a 3-week total lockdown, this thing would burn itself out. Martha Nelson, that does the COVID blog, she also says, 2 weeks and we would burn it out. Unfortunately, we're not going to do that, but here we go. So we have to do all these other tactics and techniques. Larry Brilliant, I just read this today. Larry Brilliant had an interview in March of 2020 on Wired, on Wired.com. One of the things he had mentioned on there is, this is not the zombie apocalypse. This is not a mass extinction event. 100 days later, in July of 2020, he did another interview with Stephen Levy, the person on Wired.com. Okay, we know to wear a mask, but should we still be swabbing everything with Clorox? was the question. And the answer from Larry Brilliant was, the virus does not exist very long on surfaces. I mean, you're talking about a very small percentage of cases that are caused by the pencil of the toilet seat. But if you look at things that we're worried about, like the Amazon box that comes to the door, the fact that the virus can live on surfaces doesn't mean that it does do that. I don't scrub my groceries, and he's an epidemiologist, by the way. I don't scrub my groceries, and if an Amazon box comes, I open it immediately. I'm most worried about face-to-face transmission by somebody you have had a conversation with, you're stuck in an elevator with, or just close contact with people. So that's something that he recommends in avoiding. You can look that story up, wired.com, Larry Brilliant. Tom Frieden, the former CDC director, said 99 out of 100 of us will survive. He said that months ago. Sherry Tenpenny has some great interviews. You can look at her on London Real again, Sherry Tenpenny on London Real. And don't forget that quote that I talked about with Jim Rohn in the past. Every day, stand guard at the door of your mind. I'm Dr. Scott Fuller. Immune system, health of the host, I think, is key. Thank you.